Hello everyone, welcome back to my channel. So another video for today. We are going to do catheter specimen of urine. This is the clinical skill for Osce. So let's get started. We are going to start with the pre-procedure check. You will check for the scene safety, and then if there are any hazards you need to remove them and maintain patient privacy. After that, you are going to perform hand hygiene by stating all the process involved, and then let the hands dry for 30 seconds. So pre-procedure checks are done. Now we are going to do introduction. You are going to introduce yourself and the purpose of the encounter. You are going to explain it to the patient why you are there and what you want to do and gain their consent. The second step is you are going to ask their full name, date of birth, and then the hospital number, their ID check, okay, and allergies and the reaction. Then moving on, you have to check for the patient's comfort, and if they have any concern, if they need to use the toilet or anything like that, you're going to ask them. Okay, so I'm going to explain you how you're gonna do it. The procedure will be like that. I entered the room, check for the scene safety. Scene is safe, there are no hazards, I'm happy to approach. Then the perform hand hygiene. As my hands are visibly clean, I'm going to use the alcohol hand gel, ample amount, palm to palm, palm over the dorsum, palm over the dorsum, fingers interlace, fingers interlock, thumb rotation, tips of the fingers, wrist to elbow, and allow my hands to dry for 30 seconds. Hello, my name is Jenny. I'm here. I'll be the nurse looking after you today, and I have come to take a sample of your urine from the catheter. Is that okay? All right, and then you're going to ask, could you please give me your full name, your date of birth, and your hospital number is this, and do you have any allergies? Okay, and what reaction do you get from it? And then after that you can tell them, okay, are you in pain? Is there anything else I can do for you? Do you need to use the toilet? Are you comfortable? Okay, so this is the way you are going to ask these things. Pre-procedure and introduction. Now moving on to the preparation of the equipment, you'll maintain hand hygiene, and then you are going to collect the things which you are going to use for the catheter specimen of urine. You need a bottled specimen labeled container of the urine to take the sample. Then you need a syringe, 10 ml syringe. Make sure it's dry and intact and the expiry is there. Expiry date you will check. Okay, and then basically you are going to check the packaging, and you will make sure that packaging is undamaged, it's intact and dry. Expiry date is still valid, it's in date. And then you are going to wear your apron and gloves. So now everything is ready. You move on to the actual procedure. Okay, so you can say like that, this is I have taken 10 ml syringe, it's dry and intact, and the expiry is 2025, and then you will put it on your trolley. Same way you will check for the other things whatever you are going to use, but basically with this you just need a container and a syringe and alcohol swabs. Make sure you check these are the two alcohol swabs, both are dry and intact, and the expiry is this. Okay, you are going to explain this, state it aloud, okay, because examiner won't know what you are going to do, so you need to say it loud whatever you are doing. Then we are going to start with the actual procedure. Perform hand job, okay, and then wear non-sterile gloves. You are already wearing an apron, and then you are going to expose the patient, okay, and expose only the necessary area, and inspect the sampling port if catheter of sampling port of the catheter. If there is urine, you don't need to clamp it, okay, but if there is no urine in the sampling port, you are going to clamp it few centimeters distal to the sampling port, okay. And then before taking the sample or doing anything, first of all you need to take an alcohol swab and wipe the sampling port in one stroke, okay, or circular motion. Okay, don't do it again and again because you are going to reinfect it, okay. So just do it once, one swipe, and that's it. Discard that into the orange clinical waste. Wait for 30 seconds to let it dry. So check it if you are going to use needleless system or with the needle. So if it's a needleless system, it's quite easy. You are just going to insert the syringe at 90 degrees into the sampling port, into the center of the sampling port, okay? Or you can do it according to the manufacturer guidelines. And if you are using a needle and syringe, you will insert the needle in at 45 degrees and then aspirate the required amount of the urine. But mostly in the mostly you will get needleless system, okay? So you are just going to insert the syringe in at 90 degrees, okay? Then you will take approximately 10 ml of urine. And then the most important thing in catheter specimen of urine is you need to maintain sterility by not touching the sides of the container while transferring the urine from syringe to the container, okay? And then you can state it loud, say it, okay, that I will avoid touching the sides of the container and I will maintain the sterility. And then you can discard the needle and the syringe into if you are using the needle, you can discard in the sharp container. And then after that, after taking the sample, how you are going to drop the cover of the container, place it ups and down, don't place it downwards, okay? Just place it ups and down and then cover it back, all right? And then put it there. Then you need to wipe the sampling port again with alcohol swab to make sure there are no urine residual left onto the sampling port. And then you are going to dispose of your gloves and apron, and then cover the patient back. And before you leave, this is most important, that you unclamp the catheter, okay? So if you don't unclamp, it's a fail, okay? So you must unclamp the catheter, because otherwise it will be a big problem for the patient and for you, okay? So you will have to go back to the exam center only to unclamp the catheter or do the whole procedure, okay? And after the procedure, you are going to wash your hands thoroughly. You have already removed your apron and your gloves, and then check the container, it's well labeled. If it is not labeled, you need to label it at the patient's bedside, okay? And then you can tell the patient that I have already taken your sample and I will send it to the laboratory lab within 4 hours. And immediately, maximum time you can tell them is within 4 hours, or else you are going to refrigerate it at 4 degrees, okay? And then you are also going to fill a microbiology request form and and you are going to include relevant clinical information such as signs and symptoms of the infection, antibiotic therapy, and you are going to document the whole procedure into your notes, that you have sent the sample, what time did you send, and when you get the results, you need to inform your doctor, inform the patient about the results, okay? And whatever the outcome is, you are going to explain to the patient, okay? Then after that, before you leave, you make sure that your patient is comfortable, safety is acknowledged, side rails are appropriate, okay? And then clean your hands thoroughly with alcohol hand rub, or you can wash with soap and water, and thank the patient. Guys, the most two important points in the catheter specimen of urine skill is you must unclamp and then you must maintain sterility, okay? If you do those 2 points in your exam, you will be fine, okay? All right, I hope this video was helpful. If you have any questions, don't hesitate to ask me. Share this video with your friends and colleagues who are preparing for the exam, and you can always comment in the section below if you need any help with the OSCE or for your UCO visa application for your dependents, or if you need any information about the UK, about renting a property, or about the pay slips. You can ask me any question, because there are some bits you won't be able to understand when you join, so you can always ask me, okay? Thank you so much for watching. Please like, share, subscribe. Take care and good luck for your exam. Thank you.